Henry Smith.
Madam Deputy Speaker, thank you very much for calling me in this important debate, and may I also join with other right honourable members in welcoming you to the chair. I think this is the first time I've spoken with you being in your place, and it's very good to see. Can I also extend my congratulations to the Honourable Lady, the member for Dewsbury, on her maiden speech, and again, like other honourable and right honourable members, start as well by thanking sincerely the people who work in our NHS and perform such an important task on behalf of the nation's health. When the Shadow Minister, the Honourable Member for Copeland, was giving his introductory remarks to this debate, I intervened on him and I mentioned the fact that in 2005, under a Labour government, and it was a decision made in the then Labour Department of Health, Crawley Hospital lost its accident and emergency unit. And I think in the almost over 6 decades of Crawley Newtown's history, this will have proven to be the worst possible mistake. What it meant was that the people of Crawley, which is at the natural population centre of the Health Trust area, the Surrey and Sussex Health Trust area, actually had to travel up to 10 miles up the road on single carriageway highways to access East Surrey Hospital, and the result of that has been at best inconvenience and at worst a very dangerous situation for many patients trying to reach that hospital. And South East Coast Ambulance Service do sterling work, but it's been a great challenge for them. I'm pleased that over the last 5 years we have started to see hospital services returning to Crawley Hospital. We have now an urgent treatment centre that is open 7 days a week, 24 hours a day, and we are about to see a new GP primary access at the Crawley Hospital site in West Green. I was delighted a few years ago to open the new digital mammography unit. We have increased beds, increased staffing numbers at Crawley Hospital, and indeed a new MRI scanner, which I was also pleased to open earlier this year. None of this would have been possible, Madam Deputy Speaker, had it not been for the previous government's commitment to increase funding on the NHS and through the Health and Social Care Act ensure that there are many more locally made decisions by Crawley Clinical Commissioning Group, which means that local doctors and clinicians are able to have far greater influence on the needs of my population, my constituents in Crawley, and that is a very welcome development indeed. I very much support the government's commitment to further invest and increase the funding of the NHS and ensure that GP services are extended for not only the convenience of patients, but also to ensure that we are, as far as possible, diverting those unnecessary attendances at the Urgent Treatment Centre at Crawley Hospital and A&E at East Surrey Hospital. I think that is an initiative that will have a significant impact on reducing the pressure on A&E, and in addition to that, I also support and welcome the government's commitment to ensure that social care plays an important part as well, so that people who shouldn't be detained in hospital any longer, not only for their own health needs but also for the health of the healthcare system, are able to be moved into appropriate care settings so that more capacity can be engendered for A&E. Finally, Madam Deputy Speaker, I just want to mention the future of healthcare in the Crawley area. My constituency contains Gatwick Airport, and next week we will be hearing the results of the Airports Commission into runway expansion. If indeed Gatwick is the choice of the Airports Commission, then an awful lot of infrastructure investments will need to be placed into the area, not only in terms of transport such as rail and roads, but also issues like healthcare. And I think that an absolute necessity for Crawley would be a new acute hospital with full A&E should Gatwick Airport be the final decision that the government make, although for the reasons of infrastructure pressure I don't think that would be the appropriate location. So very much welcome, Madam Deputy Speaker, what the government has done with regard to supporting our National Health Service and its commitment over this Parliament. And I look forward to playing my part in ensuring that the needs of our patients and the needs of our NHS remain a central priority.
Yeah.